To manage children with atopic dermatitis, first of all, we need to understand the long-term natural cause of the disease. So in the case of atopic dermatitis, most of us are well aware that atopic dermatitis is not an acute condition. In fact, it's a chronic, relapsing inflammatory condition that takes months to years before they go into long-term remissions. So in this case, our primary aim is not immediate cure in 2 to 4 weeks, but is to flatten the curve, early identification of any minor flare, and act promptly and to stop it efficiently. And to achieve this, we need 3 groups of medication. The first group of medicine is physical medicine, means the cream, the oral medication, tablet, and injectable. So these patients with mild to moderate atopic dermatitis, most of them require a lot of moisturizer, a little bit of steroid, a little bit of non-steroidal cream like tacrolimus and pimecrolimus over the steroid-sensitive area. Occasionally, they do need antibiotic if the eczema get secondary infected. Whereas for those with moderate to severe atopic dermatitis, they might need a form of oral or injectable treatment. And the second group of medicine is in the form of knowledge. All the atopic dermatitis patient and caregiver need to attend an educational and empowerment program. So inside the program, we're going to empower them how to identify early eczema, how to act promptly at home to stop the flare, and secondly, how to recognize the environmental factors that might induce a flare, and thirdly, we're going to elaborate on what is eczema and actively debunk what is not atopic eczema. Means we need to debunk the myth and fallacies. This is important because this could be one of the major factors for poor compliance and poor treatment response. And lastly, the third group of medicine is psychological support, tender, loving care. And this is very important for the teenager, because the teenager, although physically they are strong, they have a strong heart, muscle and bone, but psychologically they are fragile. They are fragile to negative comment, they are fragile to stigmatization in the school. As a result, they may end up with anxiety, depression, and lack of confidence. Without early detection and psychological support, again, end up with poor compliance and poor treatment response. Many caregivers, when their baby develops atopic eczema, they often notice that the skin is dry and scaly. As we all know that among children with eczema, the 3 main features are dryness, itchiness, and inflammation. And these 3 features does not act independently. In fact, they are mutually reinforcing. They create a chain reaction. Once they achieve certain momentum, they produce a cycle called vicious cycle of the dryness, itch, inflammation, infection cycle. So in order to stop this cycle, it's not about tackling one of these 3 components. In fact, you have to tackle all 3 simultaneously: dryness, itchiness, inflammation, with or without infections. So how to manage the dryness and what is the benefit of doing so? So by improving the skin hydration, it will reduce the itch, reduce the inflammation. At the same time, it has a steroid sparing effect. Means that by using adequately and routine moisturizer to improve the hydration, the itchiness will reduce and the amount of steroid needed will be lower because of this improvement. So by understanding about this cycle, the key treatment strategy is to break this cycle by targeting at these 3 components simultaneously. In other words, you need to use a lot of moisturizer, a little bit of steroid, a little bit of non-steroidal like tacrolimus, pimecrolimus. So by doing so, you can flatten the curve and maintain the curve with minimal fluctuation. So how are we going to improve the skin hydration? One of the easiest and most effective way is to get an ideal moisturizer, which I'm going to go through in my next question. Empower your child to apply immediately after every shower, And also wherever you are in an air-conditioned room, you expect low humidity, you apply more over the exposed area. Before go to sleep is another important time in the day. But don't apply immediately after sweating or during a weepy eczema, which you find it irritating. The second important steps or measure is to get a gentle cleanser. Don't aim for those 99.999 antibacterial, antiviral, because whatever you use on the skin, what we want to achieve is a balance of the good and harmful bacteria. And the third important measures is wherever you go out for any sport, especially swimming pool, keep it short. 10 to 15 minutes in a chlorinated swimming pool or in the seawater, come out, rinse off, apply moisturizer. So that's another important thing that we need to practice in our day-to-day practice.